Good afternoon, and thank you for those of you who have stayed for this last session. We appreciate it very much. So I'm Harjit Bansal. I'm Head of Equality, Diversity and Inclusion in North East London Foundation Trust. First of all, I just want to thank Sally and Ewan for this very important piece of work that they've done in terms of the research, and actually leading this research has been at the background of all of it has been the GRT community for engaging in this research. I just want to thank them all personally, all of those who have been involved. I really valued the conversations and the feedback on how we are not delivering and how we should be delivering NHS services. And I think that those are some of the critical conversations that I took away every time I came to any of those meetings. The outcomes and the recommendations of the research, one of my key objectives is going to be that I share those findings, we share the recommendations. As I don't know if people know, but North East London Foundation Trust, which is called NELFT, we call it NELFT now because the geography is quite large. So we are in London. So in London, we are in Waltham Forest, Havering, Barking and Dagenham and Redbridge. And so I'll be sharing this right across in those areas. So the geography just increases, not just in Essex, but in some of our London services. And we also have services in Kent. So we cover mental health and community services. We cover children and young people, adults and older adults. So you can see it's going to be, the audience is going to be much larger than just Essex. So it's not just about sharing the report and the recommendations, but I'll be asking local services to start thinking about how they are going to implement some of these actions, and what support would they need in order to engage and implement those. The second piece I think that came out with a lot of conversations was around data, and how we're going to ensure that we are capturing some of that data, what is on our systems. And I was talking to my colleagues this morning that I've already set up a KPI for looking at that data on a quarterly basis, and that data will be going out to all of our services so that they can start beginning to reflect on what data is telling them. And if you're not engaging with those communities, what else are we going to do to engage with those communities? A lot of discussion has taken place about the lack of awareness, and it has come up again and again. It's come up. I was really, really happy that it's also part of that human rights element around, culture. I think when we were part of this group, we were all doing, and I think Daniel and Sophia will also say, we've all been doing something. We've all been delivering some sort of awareness session, but is it consistent across? Is the messaging right? Are we capturing the right communities when we are delivering those training? And one of the three things that we promised together is that we are going to develop an e-learning tool that we are going to share across the three systems. So that's something that we have signed up to, and we will do as partners. The third thing is there's been discussions around how we embed everything that we've heard today and everything we heard from the community. How are we going to embed that in some of our existing work streams? So thinking about, we've got a suicide prevention strategy, we've got a mental health transformation strategy, we've got the safeguarding strategy. So how are we going to start beginning to embed this so that it becomes mainstream? Just like learning disabilities, I was thinking learning disabilities is a classical example of how we mainstream learning disabilities into everything we do. So that's something that we probably pick up as systems as well. Then ensuring that people have the right interpreters. I mean, we work with a local service provider in NELFT, and they provide services right across Essex and Kent. But it's how do we make sure that it's the right interpreter, they're from the right country, they're the right dialogue, they've got the right dialect. So that's a piece of work we will do as well together. One other thing that I will ensure that the GRT community have a voice in our patient participation group. So we have these patient participation teams set up. What I don't hear is that there's a voice representing GRT. So I'm going to go back and explore that and make sure that I can get particularly those community, the ones who presented today and the ones we've made some links with, get them to sign up to it. It's a very simple process, which means you then get exposure to our boards, you get exposure to sitting on interview panels. When we're thinking about mental health strategy, you're part of those discussions, so that voice becomes far more powerful. We do a lot of work in the NHS. We talk a lot about professional curiosity. We talk about open dialogue. Again, how do we ensure that those practices are competent enough to start having that voice of GRT communities in it? And how do we support our clinical staff to ask those professional curiosity questions, and what would they look like? I think, Jonathan, you picked up my point, which was in my speech today, was that we are going to review our equality impact assessment. At the moment, it says race, is the impact on race and the other 9 protected characteristics. I'm going to separate that race one and add another category around GRT, so that we can start looking at the impact of our policies for our Gypsy and Roma community groups. Most importantly, I think I really valued the engagement with all of you guys in that COP group, and I really like that to continue, because I think we shouldn't stop here now that the research has been done and we have recommendations. It's a continued change and a continued development and a continuous change. And I think if we stop sometimes, we lose the momentum. So I think it's really, really important that we keep that momentum going. I know we've had some, I'm sorry if I've taken all of your points, but I think we've had some early conversations around how do we get our inspectors to come, and also so GRT becomes part of that inspection when they come. And Sally, Ewan, we've all had conversations with CQC. They're quite keen to help. They want us to support them to think about what that inspection would look like. So I'm really excited about that piece of work, because I think that, makes it even broader than anything else. Finally, I just want to say that Gypsy and traveller communities exist in every part of every country. I grew up listening to a singer called Reshma. I just want to share this story briefly. I always thought she was a Pakistani singer until she died, and I read her biography, and then found out that actually Reshma was born to a traveller community in Punjab, so in part of India, so it wasn't even Pakistan. And she stated that the family traveled from village to village, town to town, city to city, village to village, so it was a repeated part of her life growing up. She never had a stable home. She did not access much study. She didn't go to school. But what she had was a voice that could sing. She made this a career, and she earned money to sort of feed the family and look after the family. Her father was also a singer. She remembered her parents getting sick throughout this travel. Their health deteriorated due to days on end just traveling by foot. So they used, they walked to all these places. And she used some of her funds. So if any of her parents got ill, she was using, because she was singing, she was getting some money out of that singing. She was then using that money to pay for the health. So unlike here, we wait to be registered with a GP, where she was going, she just needed money in order to access that health care. So cutting that story short, I think Gypsy and traveller communities might come from all over the world, and each bring and share their own journey, their own stories, which are unique. So what we have to do is treat them the way they would like to be treated, with dignity and respect, empowerment and empathy. We have heard, for me personally, I think I have heard so many of those stories throughout this research. And I want to start listening and doing something about it, because I think you can listen and not do anything, but I'm quite keen that we do something about it. And we can't do this on our own. We have to work with the health and the social care, the voluntary sector, the community, the patient, and the cares. That's it.
Actually, I think she's covered all the points. And if you know Harjit, absolutely fine. If you know Harjit, she is very passionate. And I think she can be quite comprehensive when she provides information like this. And for me, she's covered everything, which is fantastic. But for me, I think for me, it's just I want to reflect on this research. So this research for me, I've been doing a lot of work around understanding Gypsy Roma Traveller communities, understanding the disparities that they face when they use services. But for me, this research was more than just a research. It was our collective promise to ensure that we collectively address inequalities for people from Gypsy Roma Traveller communities and that services are equitable for them. So it really helped me to start to think about what can we do as an organisation. So my name's Danny, by the way. I work at Hertfordshire Partnership NHS Foundation Trust. We are a mental health, learning disability and autism organisation. And we provide services across 4 counties, Hertfordshire, Norfolk, Buckinghamshire, and Essex. But essentially, I started to reflect in terms of what can we do. This is an urgent call to action. The data that we've seen are quite shocking. And for me, they're more than just numbers. They're stories, their lives, their communities. There are people that have been overlooked and underserved for far too long. For me, it was a call to action. And I decided to pick up that call and started to engage within my organization. We've been engaging as a collective, thinking about what we can do collectively. We recognize there's strength in numbers. And we've started taking that conversation forward within our organization. And for me, it was to really understand what does the experience, what does access, what does outcomes look like for people from Gypsy Roma Traveller communities when they use services. And unfortunately, and not a surprise, I finally understood why we call them the hidden community. They are hidden within our data set. We couldn't identify them. And I think some of the reasons have been alluded to today. People not feeling safe and deciding to identify as white British or white Irish because it's safer to do that because it leads to less discrimination, but also because we do not have the capabilities within our systems to identify them. And that means when they have poor outcomes, we do not see them in our data. There's been a massive focus nationally around addressing inequalities within racialized communities. Some of you working within mental health will certainly know we've been doing a lot of work around patient and carer race equality framework, PCREF. And that's been very much focused around addressing disparities for racialized communities when it comes to accessing mental health services. And not a surprise, the majority of the focus is around people from predominantly Black communities and also Asian communities. But when we start to delve into the data to better understand what disparity looks like, it's quite clear, it's very much apparent that across all the metrics, that the Gypsy Roma Traveller communities are the most marginalized group in the country, from a socioeconomic standpoint, from a health standpoint, and essentially there's a need for us to ensure that we have a focus on supporting the community to address those disparities. There are some challenges, as we know. The challenges really lies around recognizing that there are acceptable racism within our services, within our institutions, even across the media, which essentially means that this is not a focus. It's not a priority. When you look at the national data, we have over 80 million people in the country. I might be slightly off. Yeah, but essentially only 1 million people are identified as from the Gypsy Roma Traveller communities. That is massively underreported. If you look across your different areas, you will see the numbers are very minuscule. I mean, we're talking 0.1% of your population. That is not the reality. We know that there are more people in the community in the country, and because we do not see them really being represented within our data, within the national census. Essentially, that means that's not a priority. And I think we have a responsibility within this space to really start to think about what we do. And there are things that we can do. And I think for me, it's about starting to understand what the disparity looks like. I could never understand, the lived experience of someone from a Gypsy Roma Traveller community. But what I can do is listen. And I think that's what we did. And there were some very powerful stories that were shared during our sessions. I think was it Shirley that's yeah, maybe shared a story, and it stuck with me, and I couldn't forget. And I just want to just briefly just highlight that, and I'll hand over to my colleague. She shared a story of she needed support. She was something happened. I think she had a fracture or so. She went into A&E, and there was interaction with the health professionals, as you can imagine. And as you can imagine, going into A&E, the waiting time is relatively long, and that means in some instances people do get frustrated being in that space. And obviously, she shared her frustrations with the healthcare, healthcare professionals in the room. And as you can imagine, she was seen as being aggressive, and that led to breakdown in communication, unwillingness to provide support and care for her, and essentially a removal of her from that space. And they invited one of their security guards to come and remove her from A&E. This is someone that needs help. She's there because she needs help, regardless of how she's interacting with you. And that's for any individual. They're there because they need your help. And sometimes people can be emotionally distressed at the same time. Our responsibility is to show compassion at all times. And sometimes we forget that because we are human as well. And we are under strain. But essentially, the security guard came in, and it was a black security guard. And she started crying, and she said, they've asked you to remove me from here. They've been, this is racism. I may look white to you, but I'm not white to them. You're being told to remove me because of my ethnicity, because of my race. And obviously he had to do his job, but he supported her. And I think for me, it became quite clear to me that sometimes racism is beyond the complexion of people's skin. It goes deeper than that. And because of that, it's become acceptable for society to allow racism towards the Gypsy Roma Traveller communities to be a comfortable conversation. If you check on social media, a lot of that comes through. And for me, it made me realize that it's time for us to start to do some reflection as an organization, within my organization, I think nationally, where have we allowed disparity to continue to thrive? And what can we do to start to address it? And I think the initial thing to do is to really start to shift that culture. There's a need for cultural shift. And I've always said this, I think change starts with each and every one of us. We're here today, we are the catalyst for change. And each and every one of you has a role to play in really trying to drive the change that we want to see. I'm going to stop there, but I just really want to thank you all for being here today. And colleagues on the call today, just really want to thank you. Ewan, Sally, you've done tremendous work really pulling this together, and really thank you for your patience with us.
So, thanks for inviting me, you and Sally and your team. I'm Sophia, so I'm from the Mid and South Essex ICB, and we've got Tina here also, who's from the same ICB. Within the ICB, I work as the Assistant Clinical Lead for Health Inequalities, and I'm also a dentist by background, so I work within our acute trust and doing stuff, delivering healthcare. But I was thinking about why this work is important. And so I was thinking back recently that I think it was about 21 years ago, when I was doing my first degree, and I had to do a sort of special topic on something that interests you. And I was reading the BMJ, and there was an article about Gypsy Roma Traveller groups and how they don't have access to primary care and things like this. So I did my sort of mini theses on the poor access to care for Gypsy Roma Traveller groups. And I found it fascinating because it didn't quite occur to me before that this was happening. And around the same time, we had a traveller community moved into a park near where we lived, and literally within a week they were gone. And I was just thinking about how, because of the area that they moved into, how quickly they would have been moved on, and how that happens to them sort of month in, day out, and how that affects them. But then when I was then doing my dental degree, shows my life story, when I was doing my dental degree about 13 years later, and we were looking at data, and the data for children's oral health in Gypsy Roma Traveller groups, again, was the poorest. And used to work in Ipswich, and literally every week we would do all clearances on children from Gypsy Roma Traveller groups. So it just showed that sort of over this 20-year span, things hadn't got better. All their teeth, yeah. So yeah, and they were always from mostly like Gypsy Roma groups. And you'll know within Ipswich, there's quite a big community. And it just showed that across that sort of 21, 22-year period, things hadn't got better. So it was quite timely around the time that Sally and Ewan started doing this work. We had within the ICB, we're thinking about our plus groups, and one of them we had identified around Gypsy Traveller, and we've now been able to add and Showman also. So we did a sort of deep dive, and even it's quite funny because within our deep dive, it was mostly around sort of our colleagues from local authority, the ICB, and somebody within there started talking about their daughter's experience as a traveller. And it was amazing because I just thought, I hadn't even thought about the fact that we serve this community, but actually these community also work with us. So it just made me think about even some of the conversations we have within our professional spaces. Are we even excluding people by some of the things we say because we don't know about their background? So I think one of the things is that it's really easy for us to, as sort of organizations, to do these knee-jerk reactions where we do an intervention because we want to show that we're doing an intervention. And I think somebody said earlier about parachuting in and then parachuting back out again once the money stopped. And I think when we have research like this, it's very much about solutions. It's about working with communities, hearing their voices, and moving towards action, and not just another perfect data set, which we're always looking for. So in terms of what we will be doing, what we have been doing, so I've been socializing this work, and people within our system are really excited and want to hear about it. And we have quite a big Gypsy Roma Traveller community within Thurrock, and they've been involved with this project. And it's sort of testament to this project also, but when there was some changes being made around how the services in Thurrock were going to be commissioned, there literally was this sort of mass email from this community of practice to Thurrock sort of saying what's going on, so it really is also holding up a mirror to all of our organizations and holding accountability for how we are delivering services and making sure that what we're doing is equitable, and I was quite impressed by that. I don't otherwise.
I remember that.
Yeah.
Good.
So another thing is about collaboration. So collaborating across Nelft and Hertfordshire, and now John and Sylvie collaborating with John. So, but thinking about within our system, we've got lots of projects and pieces of work, and how are we going to network and bring all of those things together? So Tina leads on the REN program, which is a research engagement network. We've got connectors. We've got various different programs, and it's just thinking about how can we make sure that using this research and what we've learned, we're going to make sure that those programs become a lot more focused in on those GRT communities, and use that lens to think about, is there more that needs to be done? We had Sherry, who's very passionate about what she does, and she's a real sort of testament. And oh, do I have to speak louder? I don't have a loud voice. Yeah, and Sherry, so we've linked Sherry in, and that sort of Basildon Health and Wellbeing Board with our Basildon Alliance. So they'll be working a lot more closer, and they'll be more sort of connected about what's being done around the Gypsy Roma Traveller groups within Basildon, which was a really important connection for us to make. And then thinking about policy. So one thing I've been championing within our ICB recently is about social justice, and a lot of this stuff around discrimination and biases, sort of racism, stigma, all of this really is about how do we think differently about how we are making our policies and being more sort of socially justified. Is that a terminology? Yeah. Thinking about that. And I think actually if we do that, go one step back and think about as systems, how are we really thinking about these things within our policies, we would do really well, and actually probably would spend less time thinking about these small things we do and being a lot more impactful if we go back to square one. And then, yeah, thinking about cultural competencies. we had a patient recently, which was hilarious. So essentially, this gentleman turned up to have a CT scan, and they didn't know anything about him, how he got there, but he had a letter, and his date of birth was the 1st of the 1st, 1957. And then I said, "Oh, what's your date of birth?" And then he gave me another date of birth. And then I was like, "Oh, but this says this is what your date of birth is." And I was like, "Well, what about your address?" And then the address was like a traveller site. And of the whole, was like, award staff, there was only one person on there that basically said, "Oh, you do realize that like the 1st of the 1st of a year is a really common date of birth." But actually, none of us had that cultural competency to know that, oh, actually, that's what this is about. And that's why he's got this common surname. So we do need to make sure that when we know that we've got a particular big community around us, that our staff is aware of what their sort of cultures and traditions are, and not act suspiciously towards them when they come into our services. So that cultural competency, but also not in a generic way. I really want our staff to start hearing these lived experiences and reflecting on how do they approach patients from different cultures and what they've heard. Will they change their practice according to that? So I think that's it. Data is very important. CQC is very important. Undergraduate training, I think, also is something that we need to look at. And mostly, I think we just need to thank Sally, not Sally, yeah, Sally, Sally and Ewan and the rest of the team for putting all of this work together. And I think the more that we can do to support them and make sure that we make this community of practice really impactful will do great in our region.